Hey, you guys, welcome to day 16 of our March Madness practice questions. Before we get into anything, I just want to say thank y'all for giving me the feedback. I am loving all of the positive and success stories that I'm hearing from you guys. You reaching out, letting me know that certain things are sticking. Some of us have started working together, but all of the changes in growth is why I do this. I'm not just saying that to say it, but it truly makes me happy because the way I see stuff, I try to put it in a format for things that I wish that I had 10 years ago. And, my teaching styles are different, and students and my reviewers in the past really I always speak about it, but I never really know if it's helping, if you need me to do more, if you needed, certain topics more. But I've been receiving a lot of good feedback from our March Madness, and I'm loving it, and I'm so happy for y'all. So if you need any specific topics, let me know so we can keep progressing. Again, this is for y'all to be successful, learning how to apply the knowledge that you already have because you already know it. It's just kind of gearing it, breaking it down, helping it stick a little bit better, and helping you to apply it with how the test is asking it. Sometimes we just need that little tidbit of information to tweak how we review, and then the game changes. But y'all know, as always, I like to do my intro and disclaimer before we get into any material or content. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, 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 y'all. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. And I design courses and content and videos like these to assist nurses and nurse practitioners with being successful on boards as well as in practice. But I always give the disclaimer to remind us that, there's no absolutes in medicine. So we treat on a patient by patient basis. I design questions that are what the current test is testing on, the current test, and what guidelines they are using. So sometimes that varies from the current guidelines we are using in practice. I know this, and I will always clarify the two that differs so that there's no confusion. But I like to tell you that so when you're thinking of those questions, if you're practicing, this is why. But all right, let's get into our questions for today. All right, question number one. Give it a second to come up and then I'll get into it. All right, so question number one states a patient has a 10 millimeter induration noted on exam, and the nurse practitioner is explaining to the NP student which population is considered positive with the 10 millimeter induration. All are correct except A, highly populated areas, B, travelers to prevalent areas in the last 5 years, C, small children under the age of 5, or D, immunocompromised patients. Take a moment and tell me what you think in the comments. All right, I always recommend reading the stem of the question first. I know you're always like, okay, you know how you know to do something, but you think it's like, oh, girl, I don't have time to do that. Trust me, do it. Do it, do it, do it, do it, do it. And thank me later because it's going to slow you down on that exam to eliminate some of the careless mistakes. It's making you slow down and ensure that you're answering what they are even asking you, right? So this one states all are correct except, so we're looking for which one is incorrect, right? So what are we talking about here? It's a 10 millimeter induration that's been noted on exam. And the nurse practitioner is explaining the populations that are considered positive based off of a 10 millimeter induration for TB PPD test, right? So, which populations fall under that 10 millimeter induration category? Is it people that are in highly populated areas? Yes, that's correct. Travelers to prevalent areas in the last 5 years? Yes, that's correct. Small children under the age of 5? Yeah, that's correct. Immunocompromised patients. And so that's correct also, but not for 10 millimeter induration, right? That's for 5 millimeter induration. So be sure that you know which populations fall into those categories. So for 5 millimeter, that's your immunocompromised patients or someone who may have been in contact with somebody who was recently diagnosed with tuberculosis. The 10 millimeter are the people in highly populated areas, like people who work in hospitals or prisons or children in daycare centers, travelers to prevalent areas in the last 5 years, small children under the age of 5. So just make sure you know all that. And you know that 15 millimeter in duration, that's for everybody, healthy people. So if it's 15 millimeters, that's considered positive, and you go on to the next steps of your chest x-ray and sputum culture, okay? for your TB assessment. All right, let's get into question number 2. All right. Question number 2 states a patient presents to the office today for follow up. He has a history of diabetes and hypertension. At the previous appointment, he complained of elevated blood sugar readings in the morning. The nurse practitioner had him to keep a log for 1 week with early morning and nighttime readings. His log ranges in the 250s in the morning and 46 to 54 at bedtime. Based on these findings, how should the nurse practitioner diagnose? Is it A, dawn phenomenon, B, the Samoji effect, C, hyperglycemic response, or D, no new diagnosis, he has a history of diabetes already? Take a moment to tell me what you think in the comments. All right, so the stem of the question says, based on these findings, how should the nurse practitioner diagnose? So I always tell you when they're asking you how they diagnose, you need to take it back and see how they presented. What was the assessment, right? What did you assess? What were the subjective findings and objective findings, right? So they came in complaining of these early morning um, elevated blood sugar readings, right? And so then the nurse practitioner did a request for logs checking in the morning and nighttime. Now, as you review these, we can see it's in the 250s in the morning, so it's elevated in the mornings, and then at night it's actually kind of low, pretty low from 46 to 54 at bedtime. So just understanding. So let's go through dawn phenomenon, potentially Samoji effect. Yeah, think it's emoji, right? Hyperglycemic response. I mean, there's hyperglycemia, but this is not a true diagnosis. So you can eliminate C. D, no new diagnosis. He has history of diabetes. He does have a history of diabetes, but there is a specific diagnosis for this presentation. So now you narrowed it down to 2, and you commonly come in areas like this, but you need to know. And when I do my review courses and I teach, I always say when there's similar things, I like to try to show you the way things that present similarly. I try to show you the way to differentiate between the two. So dawn phenomenon and Samoji effect have similar presentations with those morning hyperglycemic readings, right? And so you need to know how to differentiate. So I always say, the dawn phenomenon, Brittany's brilliance is think at the crack of dawn because it's early in the morning, early morning readings is when it's elevated, right? Just those early mornings, like the crack of dawn, they have the early morning readings. Now with Samoji effect, Brittany's brilliance, Samoji is the person who like found this information and this what is the word I'm trying to say? Like this type of phenomenon. And so that's why it's named Samoji effect based off their last name. So no disrespect, but I always say it's a different name, a different word. So it's a different scenario. That's my way of remembering it. And that's the way I teach it. So with this, they present with those early morning hyperglycemic readings. So they have those early morning elevated blood sugar levels, but they have hypoglycemia, the low blood sugar readings at night. So what's happening is truly the issue is the nighttime hypoglycemia, because what's happening is at nighttime something either they're on diabetic medications that are lowering their blood sugar levels. Sometimes they have changed their regimen. They may not be eating the same at night. They may exercise differently at night, but something is causing this nighttime hypoglycemia, which in turn, with a rebound effect, is causing the morning hyperglycemia, which is the Samoji effect. And that's what is clearly noted here. And if we are speaking treatment, then you want to adjust whatever is causing that nighttime awakening, and then you'll start to see those morning hyperglycemic readings resolve. But to answer the question, how should the nurse practitioner diagnose? It should be B, Samoji effect. Okay. I know that was a mouthful, but I wanted to tie all those pieces together while we were already on the topic. All right. And number 3, last question for today. Upon exam, the nurse practitioner notes a Herald patch to the patient's trunk. What is the best diagnosis based on these findings? Is it A, rosacea, B, atopic dermatitis, C, eczema, or D, pityriasis rosea? Take a moment and tell me what you got in the comments. Don't be shy. Tell me what you got. Tell me what you got. All right, stem of the question states, what is the best diagnosis based on these findings? Again, we're thinking diagnosis, take it back. and see how they present it, see what you have assessed subjectively, objectively. What do we have here, right? So the patient is just coming in for an exam. But on this exam, objectively, the nurse has assessed this patient and notes a hero patch on the patient's trunk. So just based on that alone, what is the best finding, the best diagnosis based off of that? So you got to know your derm. You have to know those key identifiers. This is one of those things where I sing and I do the same. When I say this, you say that. That's one of these things. When I say hero patch, you should say pityriasis rosea. If I say Christmas tree pattern rash, you should say pityriasis rosea, because that is that hands down, right? But also, when they're telling you stuff about dermatology, if they give you a scenario, pay attention to the location. If you're taking ANCC and they give you an image, pay attention to location. Here they tell you it's on the trunk. If you see a picture of a patient and it's the trunk, think about what they're showing you and tie this together. Pityriasis rosea, classic, commonly seen on the trunk. They're the ones with the hero patch. They're the one with the Christmas tree pattern rash, right? Rosea typically on the face, more of the red and inflamed areas, so rosacea, you can take that off, right? Atopic dermatitis and eczema, same thing. Know your terminology. If they have dual terms, know both for purposes like this. I put them both on here just in case you don't know it, so I can give you a learning lesson so that you can identify and pay attention to it. Most of you probably looked at it and like, why should you have both of these? That's a trick. But just doing that to reiterate why we should know the additional terms. But again, answer here is D, pityriasis rosea. And I'm big on when we talk derm, and y'all know I always do this rant. For those of you who are new to me, probably not familiar with it, but even like in my review book, I have it broken down like this. I'm a visual learner, and so I like charts, I like pictures, I like things. But when we're talking derm, I say have it in a chart, break it down to what the actual diagnosis is, the description of it, knowing those key identifiers in the description. Um, if there's any particular measurements, any typical particular terms like bulla and things like that, know those. And also Google the images so you can visualize what you're saying. Because sometimes it's like a hero patch on the trunk, and you're like, what is that? A Christmas tree pattern rash. I mean, what? They got a Christmas tree? Like you don't, until you look at it, then you're like, oh, okay, got it. I get what they're meaning. So Google the images so you can visualize and match it with what the terms and descriptions are saying. It's going to help with retention, trust me. And then the treatments. And then the second line therapy in the event that first line doesn't work, or second, if the first line you're allergic. Know all of those things, okay? And thank me later. Trust me, I'm only going to give you the game that's going to help you out. So try it out. But as always, you guys, be sure to like, comment, subscribe, and share with whomever may find this beneficial. I appreciate each of you. If there's something that you need me to go over or would like to see in a question, shoot it to me. Again, we're doing this all month long. We've been trucking along with our March Madness, and I'm loving the feedback. If you need the Nursing Studio for any additional help as you're preparing for boards, or if you're retesting, and we commonly help with those who have previously been unsuccessful and looking to really hone in on those areas. We offer review courses to prepare you for boards. We have online self-paced courses. We have our upcoming 5-week intensive uh, that we do throughout the year. Our next one is coming up soon. Check it in the description. Um, Also, we do one-on-one sessions as well. Like I discussed, we have a review book. You can get it via ebook, or you can have it shipped to you paperback, um, found on Amazon. Also, the one-on-one sessions are broken down in various ways. We do like custom packages if you are retesting or trying to prepare and hone in on a certain area, geared to what your needs are and where your previous test has shown that you may have had weaknesses. We also work through weak areas if it's just something that you're saying, hey, I've been studying, I just can't get this down. We spend time during those sessions doing that. Some people just want to do practice questions, just one-on-one, to kind of see how you do. And then there's some people, hey, I'm getting ready to test. I just wanted to check my readiness. Let's run through it. And sometimes that's what you want to do. But if you need any other things, just reach out to us at the Nursing Studio. We love the consultations. We do. I have had a lot of questions as y'all search for us. We do have a website. It's the nursingstudio.org, O-R-G. A lot of people go to com. It's O-R-G, the nursingstudio.org. That kind of gives an overview of everything that we do, but to really gauge what you need and everything, we prefer the consultation via telephone or email so that we can really gauge what you need. Okay. So, again, if you need us, reach out to the Nursing Studio at 803 400 6864 or shoot us an email at the nursing studio, the number one, at gmail.com. And I look forward to working with you. But y'all keep on pushing through. Don't be discouraged. Keep trucking, keep trucking, keep trucking. You got this. Happy studying. Bye, y'all.